Okay, good afternoon to everyone. I am Priya Tiwari from Faculty of Pharmaceutical Sciences, Rama University. So today I am here to present the topic on introduction to different dosage form. But before going to start the topic, firstly we should know about the following terms. Like first is drug, second is route of administration, and third is dosage form. So starting with the drug. A drug is any chemical compound with pharmacological intended for used in diagnosis, prevention and cure of a diseases. Generally, drug is also known as API. API. What is the full form of API? API is also known as active pharmaceutical ingredients. So now moving to the second term, that is the route of administration. Second term is route of administration. So, a route of administration is the path by which the drug is taken to the body, and third term is our dosage form. So, our dosage form can be defined as the physical form of a dose of a chemical compound used as a drug or medication intended for administration or consumption. So, now further proceed. A particular dose may exist in many dosage forms because different administration routes are required for medical conditions. So, there are different kinds of route of administration, like that topical, like that oral, and like that parenteral, etc. So, there are different kinds of route of administration. So, after this the following term, suddenly we move to the introduction of different dosage form, that means the classification of dosage form. So, if we are talking about the classification of dosage form, so dosage form can be divided into following three parts. First, dosage form is divided following to the first physical state, according to the physical state, second according to the route of administration, third site of application. So, they are the major three types. Then we classify the route of classify the dosage form. So, if you are talking about the physical state, so according to the physical state, the dosage form can be classified into the solid dosage form, semi-solid dosage form, liquid dosage form, and gaseous dosage form. Now we further moving to the route of administration. So if you are talking about the route of administration, so dosage form are classified into topical, second oral, and third is parenteral. So this is the classification based on the route of administration. Now third is the site of application. So if you are considered the site of application, so dosage form can be classified into like that: skin, hair, food, etc. So they are the basically mainly three types of classification. Now following proceed the first type of, that is the physical state. So we consider the classification of the basis of their physical state. So according to the physical state, dosage form can be classified mainly into these categories. First is solid dosage form, second is liquid dosage form, third is semi-solid dosage form, fourth is gaseous dosage form, and last is miscellaneous dosage form. So starting with the solid dosage form. Solid dosage form has been divided into two main categories. First is unit dosage form and second is bulk dosage form. Suddenly, unit dosage form can be classified as the amount of medication administration to a patient in a single dose. In another word, unit dosage form can be defined as that means we don't need to measure the quantity. And there is the bulk dosage form. So bulk dosage form can be defined as the in which we need to measure the quantity. So now unit dosage form has been divided into their following categories. First is tablets, capsules, pills, gadgets, and last is the powders. Bulk dosage form is again classified into two main categories. First is internal, second is external. So if you are talking about the internal, so there is the example of granules and fine powder. And external, there are three main categories. First is dusting powder, second is dental powders, and last is insufflations. Generally starting with the dusting powder. So dusting powder are those powder which are used for the treatment of fungal infection. Second is the dental powder. Generally dental powders available into the mainly gaseous form, gel form and powder form. So dental powder is generally used for the cleaning of the teeth with aid of the toothbrush. And third is the insufflation. Insufflation can be defined as the which are used for the blowing something into the body cavity. Unit dosage form are first class is tablets. So tablets is following further into divided class. First is soluble tablet, second is buccal tablet, third is chewable tablets, next is soluble tablets, lozenges and coated tablets. So starting with the soluble tablets. Soluble tablets are those tablets which are easily soluble in a liquid. For example, as a Disprin or aspirin tablet. Our second is buccal tablets. Buccal tablet, for example, as a Fentora tablets. Third is chewable tablet. Chewable tablets are those tablets which are slowly dissolved in the mouth. For example, as a ostrocalcium tablet. Second is sublingual. Sublingual tablet is the second fastest route after than IV. Sublingual tablets are placed under the tongue. Second class is lozenges tablet. Lozenges tablets, for example, is a Vicks, and last is a coated tablets. Coated tablets is further divided into following categories. Number one is film coated tablets, sugar coated tablets, compressed coated tablets, and last is enteric coated tablets. So after that tablets, we are going to the capsule dosage form. This is also a solid unit dosage form. Capsules are most commonly and popular in the pharmaceutical industry. Capsules are easier to swallow and they manufacture when the drug can't be compacted in a solid tablets. Capsule has been divided into two following category. First is hard gelatin capsule and second is soft gelatin capsule. Now further we are going to the pills. Pills is also a solid unit dosage form. They are spherical in shape and they are solid oral dosage forms. Now we are going to the cachets. Cachets are those tablets in which the quantity of medicament is more than the capsules. They are again classified into two main categories. First is dry seal and second is wet seal. And last is the powder. So powder is a category of bulk dosage form. So after discussing that solid dosage form, now we are moving to the liquid dosage form. So if we are talking about the liquid dosage form, so there are the two main classification. First is monophasic liquid dosage form and second is the biphasic liquid dosage form. Monophasic term is made up of two words. First is mono and second is phasic. Generally, we all knows that mono means one and phasic means phase. So monophasic liquid dosage form are those liquid dosage form which are made by one phase, and in biphasic liquid system, bi means two and phase means medium or phase. So biphasic liquid dosage form are those liquid dosage form which are made by the two phases. So starting with the monophasic liquid dosage form. Monophasic liquid dosage form is further divided into two main category. Number one is aqueous and number second is non-aqueous. Aqueous means water, generally water. So aqueous liquid dosage form are those liquid dosage form which contain the medium of water, and in non-aqueous liquid dosage form they contain the other than water. So starting with the aqueous dosage form, they are internal, also known as internal dosage form. For example, like that syrup, elixir, tinctures and drops. Starting with the syrups. Generally syrup are the monophasic liquid dosage form. They are viscous in nature, they are sweet in nature and they contain 66.7% weight by weight of sucrose. Second is elixir. Elixir are the hydroalcoholic clear viscous liquid dosage form. Third is tinctures. Tinctures are the alcoholic and hydroalcoholic liquid dosage form. Now moving to the non-aqueous dosage form. So in the non-aqueous category, there are the lotions, gargles, mouthwashes and liniment. These are the example of non-aqueous liquid dosage form. Now further we are going to the biphasic liquid dosage form. So biphasic liquid dosage form is divided into two main examples. First is emulsion and second is suspension. Emulsions are those liquid they are defined as the mixture of two immiscible liquids. They are miscible with the help of emulsifying agents. They are divided into two categories. First is oil in water and second is water in oil. Now second is the suspension. Suspension is also contain the example, that is flocculated suspension, and second is deflocculated suspension. So after that the solid dosage form, liquid dosage form. Now our third category of semi-solid dosage form. So semi-solid dosage form are those dosage form which are greasy in texture. So they are the examples of like that ointment, paste, jellies and suppositories. Suppositories is further divided into three main categories. Number one is rectal, number two is vaginal, and number three is urethral. Other category is ear cones and nose buggies. Now we are fourth category is gaseous dosage form. Gaseous dosage form are like that aerosols, and last category is miscellaneous. Miscellaneous, that is the NDDS. What is the full form of NDDS? Novel Drug Delivery System. These category of nano based category like that lyosomes, neosomes, etc. Liposomes, neosomes, etc. So this is the whole classification of introduction to different dosage form.